Hey, hey, are we on? Are we on? Yes, we are on. Welcome, welcome, welcome. Thanks for joining me. It is Dr. Dawn, Chicago's on board certified OBGYN and best-selling author. My mission is to empower women of all ages with pertinent reproductive health information. That information, I believe, will optimize your physical and your mental health and help you to do better for yourself. So I come on this every week to kind of give you this information because I really feel like when you know more, you do better. So I just want to welcome you all for coming and joining me here today. So if you are here, let me know. Just let me know. I am talking to a laptop, but I know my friends and family are here watching, so just give me a shout out and let me know. Today, what we're going to be talking about is actually one of my favorite topics. It's called LARC. It's long-acting reversible contraception. Long-acting reversible contraception. And they are actually two medications or two devices that we use to help us to achieve this contraception. Now, the difference between this and last week that I talked about were birth control pills. And birth control pills, they are in the same family of things like the contraceptive ring, the patch, all those are really the same thing, meaning that you're doing those things either every day or every week to get your contraception. The difference with the long acting is the long acting will, the long acting actually acts for years at a time. So when we are thinking about long acting, we're specifically talking about IUDs, which stands for the intrauterine devices, and contraceptive implants. So those are those single rod implants that are out and they go into your arm. The IUDs go into your uterus. Intrauterine, they go into your uterus. So usually you will go to your provider and that doctor or nurse practitioner or midwife, they will place the device within the uterus. And it's something you can do in your office. It's not a surgery, so you can get that done as quickly as you need it. And one of the other things that we look at with this long-acting reversible contraception is it's something that we can use immediately after delivery, after you give birth to your child. So what's interesting is my hospital and a lot of hospitals have instituted programs where we can actually put either the IUD immediately in after, right after you deliver, if that's what you have discussed with your doc prior to delivering, or we can put the implant in before you leave. So most people will stay in the hospital at least one night, depending on whether you have a vaginal delivery or whether you have a C-section. So that will determine how long you're going to be in the hospital. And while you're there, we can get this contraception in place. Why is that important? Why are we even thinking about long-term contraception? And why is it important for these hospitals to have them in place while women are, there after labor and delivering in the immediate postpartum time period? We do that because we want to decrease the amount of pregnancies that are unintended. So women that are getting pregnant that A, just haven't gotten access to their doc, B, they've tried different methods and they haven't worked out for them. So we're trying to really decrease the number of women that are coming in and they are pregnant and they either don't know or it's unplanned. Because we know that there can be different outcomes from that when we have unplanned pregnancies. They can have emotional impact, they can have financial impact. So we really are trying to work towards preventative medicine, and that includes helping prevent pregnancies when we can. So the first one we'll talk about is the intrauterine device, or the IUD. I have spoken about the IUD as one of my favorite contraceptions out there because it's something that you can put in place and not have to think about it. And for women that are busy, they have other children, they have jobs, or they're at home and they're taking care of, groceries and keeping the house together, or maybe you just don't want to have to think about birth control methods all the time. That's not something that you feel like worrying about on a daily basis. This is where these type of devices can come and play for you. And I have to give my own caveat. I think contraception is important to women because it gives you the freedom to live your life on your own terms. It's a very big responsibility having children. There's a lot that goes into that, not just the finances, but the time, the emotions, how you have to nurture that child. So I think it's important for women to use contraception to their advantage so they're able to have children when they want to have children, when they are ready to have children, and have the amount of children that they want to have as well. Those of us that are, 70s and 60s babies, we are very familiar with our parents or cousins or even people in our own comrades. We have big families. They have families that are 4, 5, 6, 7, 8 years old. That is largely because women were not using birth control methods or contraception to the degree that we are now. And I think that it really can impact a woman's quality of life when she's able to decide when she wants to get pregnant. So that's just my own personal reason why I really try to educate women about contraception and why I feel long-acting reversible contraception is important. So long-acting, like I said, is going to be available for at least a year. For the IUDs, they can be in place depending on whether they have a hormone. The hormone that we're talking about is progesterone, or whether it's not going to have a hormone in it. And so when we're talking about the IUD, that's the copper IUD. So the copper IUD is basically, I'm going to just draw it to you. So this is really the size of it. Okay, that's the size of it. It's very small, and it comes with an applicator, and we place it in the uterus. Usually, it goes right through that cervix. There used to be a advice for us as providers to do it during your menstrual cycle, because the idea is that your cervix is a little bit dilated because you have the blood flow, and it's a little easier to get through. They've had a lot of studies going through, and it's saying that that's not necessarily the case. It's important to get that IUD in when you guys come to us. So whether or not you're on your menstrual cycle, we want to place that IUD because we want you to have that contraception. So that you don't have to be on your menstrual cycle to place it. But we'll use a device that goes through your cervix. The idea is to push that IUD up into the uterus, where it's kind of at the top. And you see this part here, my little makeshift pictures. It has a string that's attached to the actual device. And so that string hangs just outside of the cervix. So if this is your cervix, it's going to hang maybe a couple of centimeters outside of your cervix. And that is so that we can take it out. So although it's a procedure that we have to do to place it, it's very easy to get these IUDs out. We just kind of grab a ring forceps and kind of pull, and it comes out because they're very pliable, those IUDs. So with the copper IUD, does not stop pregnancy. What it is it stops the sperm from actually reaching the egg and creating fertilization in the first place. So that cervical mucus is so thick that sperm is not able to get up into the cavity of the uterus, and so that's how the copper specifically. The progestin IUDs work similarly, but they also, because of that progesterone, if you looked at my video from last week and we talked about estrogen and progesterone that are both in the birth control pills, we know that the progesterone acts locally inside that uterus to kind of thin out that lining. So it doesn't let that lining get created. And we know that lining is necessary because it forms a placenta, which feeds the embryo when it's growing. So not only do we not have that sperm able to get into the uterus to fertilize the egg, we know that that lining itself is not in place. So we have a lot of mechanisms that are working to help that IUD help you to stop getting pregnant. So with the progestin IUD, that one you can leave in 3 to 5 years. So we can place it. We usually will give you a little card that you can put in your wallet, and we'll have the date when you have it placed, and we have a date when you need to have it out. With the copper IUD, you can leave that in for 10 years, and that's a great time. You talk about somebody comes in at 25 and they're 35 and they have, that's when that IUD is due to come out. Now, it could come out before then. So let's say in 2 years you decide you want to have more kids, you just pull it out. Your ability to get pregnant is not changed. You're still ovulating that like you typically do. So you should be able to get pregnant in the same manner that you were prior to putting that IUD in. Now, the what I'll talk about some of the tales that women come and they tell me about when they're nervous about getting the IUD when I bring it in. Is it painful when you put it in? It can be a little crampy. So I will ask my ladies to take some Tylenol or take some ibuprofen, whatever their pain medicine of choice is. Take that before you come, because you will get a little cramping. It shouldn't be something that's, you know, really awful where you like holding on to the table and this is just the worst thing ever. I should have just had surgery. It's not like that. So mentally just prepare yourself. No, you might have some cramping, but it's not going to be to the point where you can't tolerate it, especially if you use your medicine before. What is the rate of expulsion? Depending on the woman, depending on whether she's had kids or not, you can have the rate of expulsion, meaning that it comes back out. So we know that the cervix is connected to your uterus. It's in your uterus, but maybe you have a lot of cramping, you have a heavy period, it may come out or may come partially out. Low rates of that, maybe 5 to 10, upwards to 20%, depending on whether that woman has had a child or not. But again, it's very, when you think about it, not as frequent as people will talk about it being. So you all know I have my little cheat sheet. So I want to make sure I get everything in place with you guys. So those are the main things that women are concerned about. Does it hurt when you place it? Not that much. Does it come back out? Usually it's in place. So now another benefit of the progestin IUD that I love is that it decreases the amount of bleeding you have. So a lot of ladies are coming in and they have this really heavy menstrual cycles, heavy bleeding. And we talked about last week, birth control pills are really good to use for heavy bleeding. But the IUD is also, the progestin IUD is also very useful in decreasing your bleeding. So you can decrease it by 50%. You can have super, super heavy to very minimal, maybe just spotting. So that is something that's very helpful for ladies that have heavy bleeding and also want to have contraception. So that's where the progestin IUD works pretty well. The other reason why the IUDs are very useful and the contraceptive implant also falls in this category is that very low rate of getting pregnant. So less than 1% chance of getting pregnant, which is similar to what you have if you have a tubal ligation. Tubal ligation is irreversible, however. So my ladies that come in, they say, hey, doc, I don't want to get pregnant anymore. I think I want my tubes tied because I can just get them untied if I want to get pregnant. Well, we don't really tie your tubes. We either burn them. Right now, we are taking out the whole tube. So we're doing what's called a salpingectomy. So it's not something, a tubal ligation is not necessarily something you should use for long-term contraception. That's where these devices come into play, where you should have the IUD that can last 10 years, progestin IUD can last 3 to 5 years, or the contraceptive implant, which I'll talk about in a little bit. So it's so much I want to make sure I get to you guys. So forgive me for peeking off, but this is stuff that I just wrote down to make sure I'm not missing out on it. So one of the things we have to remind you of when you get this IUD is if you find that you are missing a cycle or you think you're pregnant, you have symptoms where you have breast tenderness, you're super nauseous, come in and let us check you out, because we have to make sure that we don't have an ectopic pregnancy there. Very infrequent, but nothing is 100%. The human body does exactly what it wants. So if you think you might be pregnant and the IUD is in place, you got to get in with your doc, because if you are pregnant, we have to make sure that the pregnancy is inside your uterus and now not somewhere else, also known as ectopic pregnancy. So once again, let's talk about the side effects. With the copper IUD, you can have a little cramping when you place it. Some women do notice some cramping, a little extra cramping when they're on the menstrual cycle. And they may notice a little heavier bleeding. That's with the copper IUD. With the progestin IUD, you should have less bleeding because that progestin is a low level, but it's still a hormone. And some women are really sensitive to that. You may have some of the symptoms that you have when you are on birth control pills. So you can have some nausea, you can have some breast tenderness, you can have mild bloating. You should not have weight gain, but those are some of the things you might see with that. Some women will notice a little more irritability. Again, those symptoms are similar to what you'll see in the birth control pills because it's the progestin in there. And so it's at a low level. Theoretically, it should only act in the uterus, but some women are very sensitive to any hormone that's in their body, so they'll still have some of those symptoms. But just like the birth control pills we talked about last week, give it a couple of months. Most of those symptoms will improve after a couple of months, so that, and usually I don't have it now because I don't have my clinic, but I would have my ladies come in after 3 months just to check in on them. A lot of times they cancel because they say, hey, doc, I'm doing fine. I don't have to come in, and we just leave it at that. So that's the basics of the IUD. And if you have questions, be sure to let me know. Okay, just put your questions in the comments, and I'll be able to kind of answer them as we go. Now, the next one is the contraceptive implant, and it's a single rod implant, and it's progestin, and that one can be in place for 3 years. So again, long acting. We use a little device to put it right under your skin, so you should be able to feel it, and we put it a little superficial so we can remove it again. So one of the things people will talk about is like a little sore because we have to cut and we have to place it there, but it's not major surgery. You should, with a little Motrin or Tylenol, that should help you deal with that. You might have a little bruising at where we place it, but again, the main thing is you have long-term contraception. Main thing with the contraceptive implant is you can get some irregular bleeding. That is something that we do tend to see, that the bleeding pattern can be irregular. It could be heavier than normal. It could be less than normal. And sometimes it could be irregular in terms of when it comes. So that's something that you have to keep in mind. It's not something that we can predict, but you have to weigh whether having a 3-year contraception is worth the bleeding pattern. And of course, if you get to a point where it's really problematic, there's some things we can try. Sometimes we'll put you on a low-dose birth control pill for a couple of weeks to see if that kind of normalizes it. Progestin, as we talked about before, we talked about the birth control pills. It can destabilize or thin out that uterine lining. So because you're getting that progestin continuously, it's constantly causing that lining to shed, and that's why you can get the irregular bleeding with the implant. The implant works similarly to the progestin IUD, thickens that uterine line, thickens that cervical mucus or cervical discharge so that the sperm is not really able to penetrate and get into the uterus when you ovulate. So that is the contraceptive implant. Again, both of these devices can be placed immediately postpartum. So for ladies that know they want long-term and they want a little time in between their pregnancies, some hospitals you can put them right in place, like my hospital. You can put them in right at the day after you deliver. And when 3 years are out, then you come in, we just pull it out with little instruments, and you kind of go about your business. So long-acting contraceptive, long-acting reversible contraceptives are important for ladies that do not do well with remembering a pill every day, or they just don't want to remember a pill every day. And they are very useful for women who know that they don't want to be pregnant in the next couple of years. So those are things that we want to keep in mind. So keep those in mind when you're thinking about contraception, and definitely make sure you're thinking about contraception if you're sexually active. So the other thing to remind ladies and gentlemen of is make sure you're using your condoms, because the contraception is only one part of the puzzle. We want to protect ourselves from sexually transmitted infections, gonorrhea, chlamydia, because those things can lead to chronic pelvic pain. They can lead to scarring inside that can cause difficulty when you're trying to get pregnant. Things like herpes, you cannot get rid of. Things like HIV, you cannot get rid of. So you do have to protect yourself when you're out here and you're sexually active. Contraception is one part. Condoms should also still be something that you're using during this time. So that is really it. I try to keep these talks pretty brief. If you have any further questions, you can go actually to Dr. Dawn OBGYN. I actually have a blog that I wrote on the IUD use. That's right on my website. And so you'll be able to read that. But I also make sure that I post these videos on my site. So I'll have it posted here in Facebook. I'll have them posted on Instagram, and I also have them posted on YouTube. And so you can go to any of those channels, Dr. Dawn, OBGYN, DRDAWNE, OBGYN, and you'll be able to find me and get some more information. So now the next thing I want you guys to pay attention to, really stay alert. I'm having a webinar. Again, my goal is to help our young girls know about their reproductive health, and also to help our young teens and preteens really start to build their self-confidence and really start to improve their body image. I think we have a lot of mixed messages that are out there for our girls, and it's important that they're listening to people that really have their best interests at heart. And so I have taken it upon myself to make sure we're focusing on our young girls and making sure that they have the best opportunities to do well in this world. So webinar is going to be October 20th. That is a Tuesday. We're going to do it at 6:30 Central Standard Time. And it's going to be in Zoom, so you actually have to sign up for it. So you should be able to see on my site here, the website is clevergirlwebinar.com. Just go there and you'll be able to sign up. And we'll have about an hour or so. We'll kind of go through everything. Any questions you have, it'll be a smaller group because you have to sign up for it. And so we'll be able to kind of talk and dialogue about some concrete ways that we can help our young girls be successful by being more confident and have a better idea of what they want to do with themselves. The other thing I would like you to do is to join my Facebook group. It is the Courageous Clever Girl Creators. These are for moms, dads, aunts, uncles, anybody that's really interested in having dialogue on these topics. I usually will do these lives there as well. And a lot of times I'll go in and just kind of pop in and just talk about things that are important to you guys. So that would be something else to make sure that you are. Oh yeah, I thought it was going, but it's not. So I have my I have it down there now. Those are the websites that you can go to sign up, either to join the group or to sign up for the webinar. I'm telling you, I love Erykah Badu. She has one song where she says she is a analog girl in a digital world, and I very much understand what she's saying. You really have to work on all of the things that you have to do to make sure we get this information out. But I'm learning. I am here for it, and I am learning. I thought my ticker was going, but it wasn't. So I'm going to sit here and talk for a little bit so you all can take a look at this ticker and get these websites. But if you found this information useful, share it, tell your friends about it, have them come onto the site and check it out, because this is information I think all women should know about. Come join my webinar October 20th at 6:30. That is a Tuesday evening, 6:30 Central Time, because I'm here in Chicago. So yeah, that's about it. Let's see if we have any questions. Let's see. Right now, I don't see any questions. And that's cool. That's no problem. I am post-call, so I'm just going to go and take me a little nap. That's what I'm going to do. But thank you again for joining me. I'm really happy to be here. Meet me again here next week. We're going to be talking about polycystic ovarian syndrome. Polycystic ovarian syndrome, or PCOS. That is something that I have noticed kind of people talking about amongst themselves and on the internet. So I thought we'd talk about it ourselves as well. And the other thing to remember is this is Breast Cancer Awareness Month. So October, Breast Cancer Awareness Month. I will probably after next week talk about breast cancer wellness that third week in October, and because of the month that we're in. And I will say to all ladies, especially if you're 40 and above, or if you have immediate family like a mother or a sister that have had breast cancer, get in, make sure that you are getting your mammograms so that you can, if there is an issue, you can get checked out. So for breast cancer wellness we are going to really advise our girls to get in and get their mammograms. That's very important. So I'm going to take off. I am thankful that you all joined me, and I will be back here next Thursday, 12:30. We'll talk about PCOS, and the week after that, we're going to talk about breast cancer awareness. If you have any questions in the meantime, just, message me. I usually will see them. I won't today because I'll probably be asleep, but message me and I will respond to you and do the best I can to give you some answers. All right, guys, thanks for joining, and I will see you next week.